Our didactic today is by Lisa Chambliss. Lisa is a public health nurse and TB case manager with Lane County Public Health in Eugene, Oregon. She's been in public health since 2013. Lisa received her undergraduate degree from the University of Oregon and her nursing degree from University of Hawaii, Maui College. She's originally from Maui, where she was first introduced to TB case management, training with the Maui County Health Department, doing TB screening and LTBI clinics. So Lisa, thank you very much for volunteering to present today.
Yeah, thank you so much for having me. It's an honor, and I'll try to be as quick as possible. What I'm going to talk about today is complex case management from a case that I had 2018 to 2019, and tackling some communication barriers and disabilities. So I hope it's of value to everybody. It was quite an experience. And let's make sure I can advance the slides. So just to start off, I have no conflicts of interest and nothing to disclose. And just a brief outline, I'll introduce the case, give a little case review, and then describe some challenges working with this particular client, give some resources and tools, and I'll be reviewing some specific products, but I want to reiterate I don't endorse any particular product and have no conflicts of interest. And then if I have time, review some successes and observations. Learning objectives, which you were all sent ahead of time in the agenda, I believe, but those are there. So really quickly, a case summary. The client that I worked with was a 75-year-old female from South Korea. She had miliary tuberculosis, several comorbidities, including diabetes, uncontrolled hypertension. She had a history of a stroke that left left-sided weakness, a history of a heart attack, anemia, and then significant osteoporosis and kyphosis. She was a very tiny lady. She was 86 pounds and 4'8". With the severe kyphosis, she was very short in stature. And we treated for a total of 12 months. So it was a very long year. And then the case was deaf, nonverbal, and she was also unable to read and write, which is where this conversation is going to talk about, is communication barriers. Her primary language was Korean Sign Language. She also understood and was able to sign some American Sign Language, and then she used her own kind of pantomiming for some other signs that she didn't know. So the history of stroke left her with decreased mobility on the left, including pretty much very limited dexterity in her left hand. So she primarily signed with just her right hand. And then due to, growing up in Korea with lack of resources, she only had the education level of about a first grader. And so that also, was a huge barrier. She had very little social support. She has a son in town who is a very negative influence in her life. He's got quite a significant criminal background. And then an ex-husband who was also had a lot of his own mental health and physical health issues. So not reliable social support by any means, if not a negative role. And then so that a lot of that led to a strong lack of trust. She'd been taking an advantage of a lot of her life. So that was a hard thing to build. And she was very independent. She's lived on her own for the last 11 years, and she was a very proud woman. So some challenges. When we deal with people and interactions, we rely a lot on verbal communication, and it wasn't really an option. Of course, we jumped in and got an interpreter as quickly as we could, but there was a lot of challenges with the interpreter as well because of her mixed kind of style of language. So then we usually rely on written communication, and that wasn't an option either because she was unable to read and write. We did do a lot of pictures and symbols with the case, and that really helped us get by with most of the case management. And then her education level was also a huge challenge because she didn't have this like the understanding abstract concepts was really challenging. So an example is she didn't understand that the human body made more blood. And so she would say, "You can't take any more blood from me. I'm already so thin." And trying to explain to her that our body makes more blood, she just couldn't wrap her head around it. So that was challenging. And then we also rely on family or friends, and that was just not a reliable source for us to assist with communicating. And then, like I spoke about, building trust. Thankfully, we got pretty good trust base right out of the bat, and she trusted me really pretty quickly. But I saw that lack of trust with a lot of other people that were trying to assist us, and so that was a challenge and something we thankfully overcame quickly in our relationship. Surprisingly, it was hard to convince healthcare provider offices to hire an interpreter too. A lot of providers thought that they could get by, not understanding the complexity of the barriers. And so that was a surprising challenge that we encountered often. And then she was also often labeled as non-compliant. You know, if she doesn't know when her appointments are, she doesn't show to them, and you call to leave a voicemail for appointment reminder. And so she got dropped from practices, and her chart was often labeled as non-compliant, but really it was just a communication barrier. So some tools and resources that I discovered along the way. It was really important to establish an interpreter right out the gate. So we had to find one that we could use consistently, one that the patient might have been already familiar with. Thankfully, it's a really small community here in Lane County and Eugene. So a lot of the interpreters we had approached had worked with her before. And then it was also, you know, who our agency was contracted with. And that was one of the challenges just with a lot of the healthcare provider offices in town. And there is a registry, there's a link or a resource you can use, just Google registry for interpreters. So we use a lot of visual aids. The Multnomah County Health Department created a great flip book that we use to describe TB, and the Heartland also has a great flip book. This was a tool that I developed to do my monthly symptom screens. She got a kick out of it, especially the little poop symbol. But we used it to, you know, she pointed to the color of her urine to make sure that she wasn't experiencing any liver difficulty or things. So that was a useful tool. Labeling her non-TB meds was also important because she couldn't read the bottles. So I did a little heart for her heart meds and a star for pain meds. She didn't want to use the pill box, but it was another tool that people could use. This was a great tool that a case manager that we were working with developed using flashcards. So if she had an emergency, she could show that card to a neighbor saying, "Please call an ambulance for me, I'm deaf." So it was just a little ring with different flashcards that she could use. There's a great telephone assistance program that I think most states do have. Oregon's is through the Oregon Public Utility Commission. I think Washington has one through the Social and Human Services Division. And so they loan equipment out. And so we were able to get the client an iPad that we could use a video relay service with. And so video relay, you call and it goes to an interpreter who's on a video who signs to the client signs back, and then it verbally tells you the message over the phone. And it does require internet. So we discovered a program through Comcast where we could get internet for only $10 a month. And this is for anybody with low income. Here's some eligibility requirements. So anybody, even you know, veterans or low income seniors can utilize this program. So we were really grateful to have discovered all those tools. Senior and disabled services, other agencies and programs were also really important and vital, but also overworked and understaffed and didn't really grasp the complexity of her needs. So they were great resources, but challenging to work with and get time for them to jump in and be able to help us. Adult Protective Services, we unfortunately had to call a few times, but they were also eager to help. And then insurance company case managers and care teams, we were able to increase her acuity on what her needs were for care management team. But they're all out of state and have, will never meet the client. So that was a challenge, but useful also. Transportation services, we have RideSource here in Eugene where they pick you up and take you to medical appointments and take you back home through Medicaid. Meals on Wheels is another great resource, and nonprofit organizations for donations of medical devices. And they also have, different organizations have different options that they can assist with. So unfortunately, our client didn't want to move. She wanted to stay independent. So she didn't want to move to any assisted living. But there is one deaf assisted living community in Oregon. It's only one of 2 in the entire country, which really surprised me. But all the staff speak sign language and are able to communicate with clients. She didn't want to move, so that wasn't an option for us. And then just finding a caregiver in general is challenging for any non-English language, let alone ASL, but we were able to find a deaf caregiver that was in the home helping with her ADLs, her daily living tasks and things. So this one is actually one that my client taught me, which is using children's book to learn how to read. And as I was looking into this a little further, there's an app called the StorySign app, and it signs with a cute little cartoon the book. So it, the sign language to interpret the book so you can learn how to read, which I thought was really a great tool. So some successes really quickly: setting up an interpreter and getting that interpreter established with all of her healthcare providers, getting her case management attention, an iPad for phone, being able to utilize the phone and internet. We also got her a life alert button and a wheelchair. And we were also able to connect her with an old friend who actually lives up in Washington. And so they were able to communicate during doing the video relay directly and seeing each other's faces. And so that was a huge success. So she was less lonely. We also moved her from a 4th floor apartment to a 1st floor apartment with the help of the nonprofit organization in town. They helped move her for free. And then we got her set up with some specialty providers. We got her up to 100 pounds. And I also got to learn some sign language, which was a fun treat. Just some quick observations. Overgeneralization, but people talk really loud to deaf people. And I'm sure I did it too. I just thought that was kind of an interesting social observation. And that the healthcare system is incredibly challenging to navigate. As an RN and somebody that has been in the medical field for a little while, I even had a hard time navigating the system for her and helping connect her with these kinds of things. So it was a great reminder to myself that, we usually, say here, go to this place, get your chest x-ray done, and then do this and this. But that's, hard for anybody to navigate sometimes. And so being that assistant and kind of being able to help with that felt good, but also really frustrating. So acknowledgements to my coworkers. I couldn't have done it without their support. It was a very long year, and the interpreter that worked with us, it took her about 3 months to be comfortable communicating with the client. That's how significant the sign language barrier was. And she was only about 75% confident in her ability to understand and communicate. But she was a fantastic interpreter, and also to the Oregon Health Authority for all of their support. So thank you.